Private health insurance is one of the things that we get asked a lot about when we do the tax returns. So I've done a whole video on private health insurance, the fors and against of it, and when you need it and when you don't need it. So jump on over there and watch that one if you are still unsure whether you need private health insurance. But all I'm going to cover off here is that if your income is above the thresholds, and it is adjusted taxable income, not taxable income, so it's $90,000 for an individual or $180,000 as a couple or a family. If your income is above that, you must have private health cover that covers hospital admission. It's not ancillary or extras or any of those sorts of things. It must be hospital cover. There's some limits on how much your excess can be. So again, I've covered that off in the video, so jump over there and watch that. But the thing to remember is that to be exempt from the Medicare Levy surcharge, and that comes into play where your income's above those figures I just mentioned, you don't have private health cover, then you pay the Medicare Levy surcharge. You must have had private health cover for the full year if your income is above that level, or you still pay the surcharge for the days that you didn't have cover. And the other thing that people quite often get caught on is one party in a relationship will have private health cover and the other one doesn't. And we see this with young couples where the female will quite often have cover because they're thinking of having children and they want obstetrics cover. But to cover both people, it's quite expensive. So quite often we see the female will take a policy out in her own name and the male doesn't bother. But as a couple, if your income goes above those thresholds, even though the female had cover, they will still pay the Medicare Levy surcharge because the legislation says that every person, including dependent children, must have private health cover or the surcharge applies to all parties. So even if mum and dad have cover and the kids aren't covered, you will still pay the Medicare Levy surcharge because the dependents of that relationship weren't covered. So it's a really important thing that you do understand. When we ask you, do you have private health cover and does your partner and or your children have that same cover? That is the reason that we're asking, because data matching will find it at some point, and if you and your partner don't have cover and you've said you will, the tax office will find it and then they will send you the bill. Nobody likes to get the bill in the mail, we get that. So it's really important when we ask you that question that you know those answers when you get your tax return done. So that's all for me right now. I'll catch you all very soon and check out all my other tax time videos. There's heaps of them there. Bye for now.